What's up, everyone? Welcome back to my channels. Today we are going to talk about patellar tendon rupture. So this is a orthopedics case. We can see here it in the first photo that a patellar bone here it is attached to the patellar tendon inferiorly, which attaches to the tibial tuberosity here, and the patellar tendon attaches to the quadriceps tendon over here, and that with the quadriceps muscle. So what happens is there are two tendons, quadriceps tendon and patellar tendon. So sometimes the due to injury, due to the direct injury in the knee or in the or due to abrupt extension of the uh, knee, the tendon may get ruptured. So this might cause symptoms like extreme pain, swelling, and most importantly, inability, unable to extend knee. That is, you cannot extend the knee at 0 degree or say 180 degree. So you cannot do it by yourself, but the knee can be extended passively by some by your hand, but you cannot do it actively. So what happens after the rupture is that the patella is displaced upwards. So how to diagnose the patellar tendon rupture? You can do it by two ways. The first one is clinically diagnosing by looking at the patella, whether it is displaced or whether it is present at the usual location. You can do it in the flexed position of the knee. You can observe that, or you can palpate. Also, the radiological method is diagnostic. You can see here in the second photo, you can see the location of the normal patella in the normal knee, but here in the second picture the patella is way displaced upwards, and it is present just above the um, distal end of the femur. So you can diagnose it by doing a lateral x-ray of knee joint at flexed semi-flexed position. So what are the signs? Like I already said, pain directly under the kneecap, swelling and bruising in front of the knee, and a defect. So you can see, since the patella is displaced upward here, there is a gap or defect in the usual position of the patella. So this condition is also called knee alta, I think. So you can see it here. The patella is displaced way above, and there is a gap in the usual region of the patella. So it should have been there, but it is here displaced upwards. Likewise, similar to the patellar tendon rupture, sometimes the quadriceps tendon get also ruptured. So what happens? Just the opposite. The patella is displaced downwards, so there will be gap above the patella. So let's summarize what are the usual things that we need to know about the patellar tendon rupture. Symptoms is pain, trouble walking, and inability to stay straight knee. And the onset is usually sudden onset, either due to trauma or falling directly on the knee, jumping from height. When we jump from the height, it might get ruptured. So what are the risk factors? Risk like tendinitis. When the patellar tendon is tendinitis is initially inflamed, or it may be due to diabetes mellitus, steroid use, or CKD or kidney failure. So how to diagnose? Diagnosis can be done by clinical examination and x-ray, or sometimes you might need MRI to diagnose the partial rupture. Partial rupture can be diagnosed by MRI because it will, the typical symptoms like the gap or the displacement of patella cannot be seen in the partial rupture. So what could be the other differential diagnosis of the patellar tendon rupture? It could be the patellar fracture, or the quadriceps tendon rupture, other soft tissue injury. So what are the treatment methods? So for partial tear, partial rupture, you can just splint, immobilize, and give pain medications. But if it is complete tear, then surgery is definitive, and putting this knee on splint after surgery for at least 6 weeks should be done. So that's it for today. Any feedbacks would be appreciated, guys. Thank you very much.